family planning methods are used to A. Cure infections, B. Safely and effectively delay or prevent pregnancy, C. Enhance fertility, D. Increase sexual activity. Correct answer is B. Family planning's primary purpose is to help individuals or couples control fertility by preventing or postponing pregnancy through safe and effective methods. The basal body temperature method of family planning is A. Traditional method, B. Surgical method, C. Fertility awareness-based natural family planning method, D. Barrier method. Correct answer is C. BBT tracks body temperature changes linked to ovulation to identify fertile days, classifying it as a natural, fertility awareness-based natural family planning method. Which of the following is not a main category of family planning methods? A. Traditional methods, B. Spiritual methods, C. Natural methods, D. Artificial or modern. Correct answer is B. Family planning methods are categorized as traditional, natural, and artificial or modern. Spiritual methods are not scientifically recognized as a main category. Wearing amulets or charms as a method to prevent pregnancy is an example of A. Natural family planning, B. Artificial contraception, C. Traditional methods, D. Surgical contraception. Correct answer is C. Use of amulets or charms is based on cultural beliefs and practices, fitting into traditional family planning methods rather than medical or modern methods. Which family planning method allows for immediate return of fertility after cessation? A. Surgical sterilization, B. IUCD, C. Hormonal implants, D. Natural family planning. Correct answer is D. Natural family planning involves monitoring fertility signs without altering physiology, so fertility returns immediately once use stops, unlike hormonal or surgical methods. This cervical mucus or Billings ovulation method is based on A. Observing changes in cervical mucus consistency, B. Calculating menstrual calendar only, C. Taking basal body temperature, D. Using hormonal contraception. Correct answer A. This method identifies fertile days by monitoring variations in cervical mucus texture and appearance during the menstrual cycle. An advantage of traditional family planning methods is that they have A. Guaranteed effectiveness, B. Support existing cultural or belief systems, C. Require modern technology, D. Have clearly understood mechanisms of action. Correct answer B. Traditional methods align with cultural values and beliefs, making them socially acceptable, even if their effectiveness varies. Emergency contraceptive methods are part of which family planning main category? A. Traditional methods, B. Natural methods, C. Artificial or modern methods, D. Surgical contraception. Correct answer C. Emergency contraception uses pharmaceutical interventions, placing it within artificial or modern family planning methods. A risk of some traditional substances in family planning is that A. Physical side effects guaranteed, B. Some substances can be harmful, example, potash or blue powder, C. Total safety in all cases, D. Universal availability. Correct answer B. Traditional contraceptive substances may contain toxic ingredients causing physical harm, making safety a concern. Lactational amenorrhea method suppresses ovulation during A. First 6 months postpartum, B. Entire breastfeeding period, C. Immediately after childbirth only, D. Up to 12 months after delivery. Correct answer: A. Exclusive breastfeeding in the first 6 months postpartum naturally suppresses ovulation and menstruation, providing temporary contraception. Which method of family planning uses past menstrual cycle data to avoid pregnancy? A. Calendar rhythm method, B. Withdrawal, C. Natural breastfeeding, D. Barrier methods. Correct answer: A. This method calculates fertile and infertile days based on previous menstrual cycles to avoid intercourse during fertile periods. Lactational amenorrhea method relies on A. Oral contraceptive pills, B. Exclusive breastfeeding, C. Periodic abstinence, D. Barrier methods. Correct answer: B. Lactational amenorrhea method depends on exclusive breastfeeding to suppress ovulation naturally during the postpartum period. Coitus interruptus, or withdrawal method, means A. Male withdraws the penis before ejaculation to prevent sperm entry, B. Complete abstinence from sexual intercourse, C. Use of condoms during intercourse, D. Scheduling intercourse only during safe days. Correct answer: A. The withdrawal method involves removing the penis before ejaculation to reduce sperm entering the vagina. Natural family planning methods do not provide A. Prevention of pregnancy when used correctly, B. Protection from HIV, AIDS, and other STIs, C. Fertility awareness education, D. Inexpensive contraceptive option. Correct answer: B. Natural methods do not provide barrier protection, so they cannot prevent sexually transmitted infections. Which family planning method prevents sperm from entering the uterus via physical or chemical barriers? A. Barrier methods, B. Rhythm methods, C. Surgical methods, D. Lactational amenorrhea method. Correct answer: A. Barrier methods physically or chemically block sperm to prevent fertilization. Which of the following is a type of artificial family planning method? A. Oral pills and implants, B. Withdrawal method, C. Abstinence, D. Traditional herbs and charms. Correct answer: A. Artificial methods use modern medical technologies like hormones and devices. Voluntary surgical contraception includes A. Herbal remedies, B. Rhythm method, C. Withdrawal, D. Bilateral tubal ligation and vasectomy. Correct answer: D. These are permanent surgical procedures to prevent fertility. Which category does IUCD belong to? A. Traditional, B. Natural, C. Artificial, modern, D. Surgical contraception. Correct answer: C. IUCD is a modern device inserted into the uterus to prevent pregnancy. A client chooses bilateral tubal ligation. What should the nurse explain? A. It's a temporary hormonal method. B. It's a permanent surgical contraception. C. It requires daily medication adherence. D. It protects against STIs. Correct answer: B. Tubal ligation permanently blocks fallopian tubes, preventing pregnancy. Which natural family planning method combines temperature, cervical mucus, and other symptoms? A. Withdrawal method, B. Calendar method, C. Symptothermal method, STM. D. Barrier method. Correct answer, C. Symptothermal method uses multiple fertility signs, including basal temperature and cervical mucus, to identify fertile periods. How many questions did you get correctly? Drop your score in the comments section. If you found this video helpful, don't forget to like, share, and subscribe for more nursing and NCLEX questions.